This presentation has been completed on visual impairment and/or low vision, completed by Rogelio, Rochelle, Bernard, and Megan. Let's meet Elizabeth. Elizabeth is a 21-year-old college student at Cal State University, Sacramento, who works in the university bookstore. She's currently pursuing a degree in biology. She enjoys working out, dancing, and socializing with her friends during happy hour. Elizabeth is responsible for driving her brother to soccer practice on most weekdays. One day, while Elizabeth walked her younger brother to the soccer field, she was hit in the head by an oncoming soccer ball, which ruptured her retina. This led a permanent damage to Elizabeth's right eye and resulted in near to total visual impairment. Elizabeth is afraid of how this injury will impact her daily routines, ability to drive, and affect her participation in school activities at Sacramento State. Her doctor referred her to occupational therapy at her local health clinic.
The occupational therapist interviewed Elizabeth at her initial visit and created an occupational profile for her. As you can see on the chart, her visual impairment has impacted her daily occupations. Elizabeth stated that she is unable to drive and she has difficulty with reading and using technology. We learned that she uses medications for her headaches and has been feeling more tired than usual lately. Her education and work are impacted by her vision deficits, as she has to be more precautious during her leisure activities. Since her accident, Elizabeth stated that she would rather stay home than participate in social events with her friends. To get to know more about Elizabeth, we asked about her personal context. She is a 21-year-old college student studying biology. She has lived an active and social lifestyle throughout her life. She has a younger brother and lives with her family in an urban neighborhood that is drivable distance to her school, work, and gym. Elizabeth likes to keep herself busy. Her environment includes the Sacramento State campus where she attends school and work. She spends time in the dance studio at the gym for leisure. She attends church on Sundays and the beer pubs with her friends for happy hour. She is currently taking hybrid classes, so she watches online lectures and attends in-person labs. She stated that she needs bright lighting to see clearly and dim lighting when she has headaches. For client factors, we asked Elizabeth about her values, beliefs, and spirituality. Elizabeth doesn't like to think she has a disability because she doesn't want people to treat her differently. She values her independence and keeping herself active. She enjoys taking her younger brother to soccer practice because it's their time to bond with each other. Her education is important to her and she believes in a higher power through her Christian religion. For body functions, Elizabeth experiences challenges with quality of vision, depth perception, visual acuity, concentration, and attention difficulties. Due to her headaches, she has been feeling mood changes and nausea. For body structures, she has visual deficits due to her ruptured retina, and she experiences blurred vision, appearance of floaters, reduced peripheral vision, and she has been overusing her left eye for compensation that is causing straining and headaches.
Next, we gathered information about Elizabeth's performance patterns and skills. Elizabeth's habits include taking the long way to each class to avoid having to navigate the large crowds and biting her nails. Her routines consist of morning coffee, taking her brother to soccer practice every Monday and Wednesday evening, and her self-care bedtime routine. She identified her roles as being a daughter, sister, friend, student, dancer, and employee. Her rituals are weekly family dinners and happy hour with friends once a month. Elizabeth is having some trouble navigating Sacramento State's campus, as well as overall walking and positioning. The motor skills being affected are positioning and walking. Elizabeth's visual deficit is making it challenging for her organization, being aware of space while walking, and adapting performance. The process skills being impacted are organization, navigate, notice/respond, adjust, and accommodate. Lastly, Elizabeth is having difficulty with nonverbal skills, eye contact, and appropriate body language. The process skills being impacted are look, gesticulate, and place self.
When considering Elizabeth's condition, the biopsychosocial model is the first model that we would like to utilize, and it will assist us in creating intervention and treatment plan. The biopsychosocial model views health and illness behaviors as products of biological characteristics, behavioral factors, and social conditions. To be able to examine the biological factor that influence Elizabeth's health would be the physical trauma to the head, her sensory system, meaning her vision, the ruptured retina leading to scarring, and lastly, having fast food delivered to her leading to having a poor diet that would impact her physical well-being. Next, the thoughts, emotions, or her behaviors will lead Elizabeth to have decreased self-esteem, fear of bumping to people, or getting lost, not being able to drive, or feeling inadequate in her life or job. These changes in thoughts might lead to changes in her behaviors, such as avoiding certain situations, staying at home, and or quitting her job. These are all known to be part of the psychological factors of this model. Next, we would examine the social components of the biopsychosocial model, which examines the social factors that might influence the health of Elizabeth. For instance, her interactions with others, meaning social participations. Due to challenges in vision, she may opt to not socially engage with her peers, colleagues, and or family. It may even impact her role as a sister, daughter, employee, and as a student. For instance, her participation with others in class will be affected. She won't be able to meet with classmates for assignments, such as group activities and or presentations. Next, with the help of the environmental model of disability framework, we would be able to address the physical environment, which consists of the natural and built environment that can impact Elizabeth's participation. Environment can influence how Elizabeth engages in her meaningful occupations and how the impact of environment as a disability can affect occupational performance. The natural environment, such as the lighting and climate, will either impact or act as a disability and cannot be modified. For instance, if it's daytime and sunny outside, it might help Elizabeth participate in outdoor activities. However, if it's nighttime and dark, it will enable Elizabeth from going out and or participate in any social gatherings because she will not be able to see clearly in the dark. Next, we would be focusing on built environment, in which can be adapted and modified to optimize her occupational performance. The layout, conditions, and design of the home, community, workplace, and school can either hinder or help her. All buildings, spaces, and products that are created or modified by people, such as the ramps, pavements, and sidewalks, are aspects to consider when creating an ideal environment for Elizabeth to successfully participate in meaningful occupations and activities of daily living. These models can help us collaborate with Elizabeth and identify factors that would impact her participation in her desired occupations.
During Elizabeth's evaluation, we conducted a semi-structured interview and administered 2 standardized assessments: the full range test of visual motor integration and the social setting interview. During the interview, we will collaboratively build Elizabeth's occupational profile, learn her self-perceived strengths and areas of needed support, identify her goals, and build rapport. The full range test of visual motor integration is an objective and valid test of visual motor skills that examines how one interprets, organizes, and replicates physical elements of a stimulus. This will allow us to see where and how Elizabeth's vision loss is affecting her occupations that require visual motor integration. For example, her dancing, community mobility, and school and work demands. Because we are using the environmental model of disability, we are also administering the school setting interview to identify the environmental factors influencing her functional abilities and participation. This information gathered from these 3 evaluation tools will help guide Elizabeth's habilitative intervention plan. The first 2 habilitative interventions we will discuss are Sacramento State's resources and public transportation. We will use an educational approach to introduce Elizabeth to many resources available, like the psychological counseling services and services to students with disabilities. We will educate Elizabeth about how to set up counseling appointments, how to register with the Disabilities Office, and the process of receiving accommodations at Sacramento State. This is a habilitative educational intervention because we are giving Elizabeth the tools and resources, but it is up to her whether or not she wants to use them. Because Elizabeth is no longer able to drive, we will use a skill acquisition approach to teach her how to safely use the bus and light rail system. Teaching her these new skills will allow her to continue to participate in occupations that hold meaning and require community mobility, including getting to and from school and taking her brother to soccer practice. The last two interventions we will introduce are the Campus Trail Guide and oculomotor exercises. The Campus Trail Guide is an environmental modification and skill acquisition approach that is tied to the elements of the environmental model of disability. The Trail Guide is a raised yellow line that is installed throughout the entire campus and makes it simpler for students, staff, and visitors who are blind or low vision to navigate the campus safely and efficiently. Once installed, we will teach Elizabeth how to use the Trail Guide to get around campus and no longer have to take the long way to classes for fear of getting lost in the large crowds. Lastly, we will use oculomotor exercises such as the Brock string test, puppy peripheral chart, or swing ball pursuits as a preparatory activity to improve fixation, saccades, and pursuits, and warm up her eyes for the day. With the implementation of these 4 interventions focusing on habilitation, Elizabeth will develop and learn new skills that will increase her occupational participation and increase her confidence.
Funding sources for coverage of occupational therapy services. So unfortunately, lots of clients are unable to have OT services due to the lack of insurance, maybe coverage of insurance, or other types of financial constraints. Therefore, an important consideration to take into account is how exactly our client Elizabeth will be able to fund her time with her therapist. Luckily, Elizabeth has primary insurance through her work, Blue Shield, because she works through the University Bookstore at Sac State. As a secondary measure, she may also qualify for Medi-Cal insurance. And typically, since she is under the age of 26, she would fall under her family insurance plan, but has actually opted out for personal reasons. Applicable billing codes. So as specifically tailored to Elizabeth, there are billing codes associated with the treatments. The first billing code is associated with the evaluation, 97167, moderate complexity. So this was chosen because there were more than few performance deficits and multiple interventions. Next, there are corresponding billing codes on the right-hand side, while overview of the intervention on the left-hand side that was already described in previous slides. We have interventions related to Sacramento State resources, public transportation, and the Campus Trail Guide, which allows for Elizabeth the opportunity to properly get help from her therapist, resources, and reintegration as she needs. The billing code is 97537 for these and goes as follows. Community/work reintegration training, which could include shopping, transportation, money management, avocational activities, and/or work environment modification analysis, work task analysis, use of assistive technology devices, and adaptive equipment, which is all direct one-on-one contact. The last intervention is related to oculomotor exercises specific to Elizabeth. So these preparatory interventions align with the billing code of 97530 and go as follows. Therapeutic activities direct one-on-one with patient contact, and these activities are typically used to improve functional performance, about 15 minutes. Thank you for listening to our presentation, and here is our reference slide.